everyone. Thank you for joining us. We are starting off another one of our Wednesday briefings. We see we have quite a few folks on here, so we'll get started in just a second. And we'd love to see you all share your organization and what area you're joining from in the chat while we wait for some more folks to join. Thanks everyone for being here. All right, we have quite a few folks on, so we can officially get started. If you all don't know me, my name is Jane DeMoby. I'm an attorney here at TJC, and I'll be walking us through the call today. Next slide. So a little bit of housekeeping. We make sure that these calls are recorded, and all of our attendees will receive both the recording and the slides afterwards. We send a follow-up shortly after the call. So follow along with us in the conversation we'll have today, but often we're talking about somewhat dense policy topics. So if you need some time to review and formulate your thoughts and questions, don't worry, we will be sending all the information out to you all. So we will be answering some questions today. We've noticed that folks have some outstanding confusions about the bill, so we'll just be clarifying how things look today, as well as what you can expect moving forward. There will be a Q&A feature at the end, and we'll give you all an opportunity to ask those questions today on the spot. But again, we're always open to hear from you after the call. As I said earlier, my name is Jane DeMoby. I'm the Equal Justice Works Fellow here at TJC. I work closely with various members of our team on Medicaid and SNAP policy and cases. Today, we'll be hearing from Gordon Bonnyman, who is a staff attorney here at TJC and the organization's co-founder. He will be covering the Medicaid component of the bill and the broader implications to the healthcare system. So Gordon will be presenting on that shortly. We'll also be hearing from Signe Anderson, who is TJC's Senior Director of Nutrition Advocacy. She will cover the budget reconciliation law's impacts on SNAP. So just as a disclaimer before we get started, TJC is a nonprofit tax-exempt organization. We are nonpartisan and non-political. With the clients we serve and the partners with whom we work represent the state's diversity of political affiliation. As a result, our political analyses relate solely to the defense of health and nutrition programs and do not imply an endorsement or disapproval of any party or person. So please keep this in mind as we get into the weeds today. So one of the most important things we want to be clear on today is that the Wednesday briefings will be shifting to a monthly cadence. So from early this year until today, we've met just about every Wednesday to give you all an update on the bill as it moved through the House, through the Senate, and then was signed into law. We've needed those weekly briefings to have a conversation about what where you can take action and what updates we've learned about the bill. Now that the bill's been signed into law, we are really in a position of waiting to see what the implementation looks like on both the Medicaid / healthcare and the SNAP side. So we're going to be moving to meeting on the third Wednesday of every month and give us an opportunity to take stock really of the impacts of the bill as our state agencies here in Tennessee feel them. So we won't be meeting every Wednesday. We'll be meeting every third Wednesday of the month. And if you're already registered for this event, your calendar, the corresponding calendar update will be automatic. So keep this in mind. And if you don't see a weekly briefing next Wednesday, that's why. So please keep joining us, and we hope that this will be a more fruitful use of both of our times. That said, we are not done talking about the budget reconciliation law, even though it's been nearly 6 months of us kind of beating the drum about the bill's impacts and the concerns we have around it. We're still having that conversation, and there's a reason why. It's because a lot of the damage that the bill does, like I said earlier, requires some time to be implemented, but also there are a few components of the Medicaid and healthcare changes that we can actually take action on today. So right now, what's going on? Congress is in recess until after Labor Day. So that means that the representatives and senators are back. Our representatives and senators are back in Tennessee and available for meetings with you all, with their constituents. So they're actively campaigning in support of the bill. So it's a good time to kind of have conversations about what you might be hearing and combat any kind of claims that the bill will not have any negative effects. So uh, with our representatives and senators being back in Tennessee, it's really critical that you make yourself known, and we'll talk a little bit about what that looks like. If we're looking at the financial side, the current federal budget year ends September 30th. Typically, the current administration would have submitted a budget for the year fiscal year beginning October 1st. But for the first time in memory, the executive branch has not submitted a budget proposal to Congress. And we are not able to get a sense of what the administration's budgetary priorities will be. You might have heard of a budget release earlier in May, but the real information about that is there's just not a lot of information provided in that quote unquote skinny budget. So we just don't have a lot of information of what the new fiscal year's budget is going to look like. So, to pass a continuing resolution to fund the government past October 1st, because again, there's no budget, so there needs to be a continuing resolution. And also to prevent a government shutdown, Congress requires a simple majority in both houses, but Republicans do need Democratic votes to get it done. So there's a little bit of negotiation that can happen on the continuing resolution front. And that is, again, going back to the importance of us having or using this recess time to talk to our senators and our representatives. So we know that the bill has been signed into law. We know that Congress is in recess and the folks representing Tennessee are back in the state. We know that the budget year ends soon and there's no new budget, and there needs to be a conversation about what the budget will look like beginning October 1st. So there's a lot still up in the air, even though the budget reconciliation bill has been signed into law. Next slide, please. And the other really important thing to address is enhanced premium tax credits, which we've raised in the last few calls, because enhanced premium tax credits are a way for the marketplace health insurance to be more affordable for working families. So with those credits, families are able to afford their monthly premiums. It essentially makes monthly premiums more affordable, oftentimes by the hundreds of dollars. In December, the enhanced premium tax credits that have been in effect for the last 4 years will expire, and although they can be in a position to be extended, if they're not extended, there are 197,000 Tennesseans that will have their premiums skyrocket and will, in all likelihood, lose coverage come January. So we're in a position to advocate for the extension of enhanced premium tax credits for the tens of thousands of people who are in the Affordable Care Act marketplace. So that is our battleground. In addition to some of the conversations around the budget, that is our battleground during this recess period and onwards. So we're pushing for extension of the enhanced premium tax credits so that we don't jeopardize the health coverage of the folks that are relying on the marketplace. So that campaign starts now. We are doing our part to inform you all about not only the harmful effects of the bill, but some of these other changes that are surrounding the healthcare system. And we hope that you all will take action about on some of what we share, in addition to continuing to share that the bill is harmful and that the negative effects will be coming down the pipe. Gordon and Signy are going to go through the specifics of the impacts of the Budget Reconciliation Law, which you might hear referred to as the One Big Beautiful Bill Act. Gordon will cover healthcare, as I said earlier, and Sydney will cover SNAP. And some of the things we've covered previously, and we've shared resources on are the potential coverage losses through the ACA, the Affordable Care Act. Nursing homes are in danger. 10 care enrollment is likely to decrease from red tape. Some immigrants are losing eligibility for coverage, and the rural healthcare system is in jeopardy. And and it remains to be seen how it will benefit from some of the provisions in the bill. On the SNAP side, the major danger is around work requirements and cost shifting to states. We're also concerned about SNAP education funding. Again, some qualified immigrants losing, or some immigrants losing eligibility, as well as SNAP benefit amounts reducing. So we've talked a lot about both of these buckets over the last few weeks, and Gordon and Signy are going to spend today digging into what you need to know today. And now I'm going to turn it over to Gordon. As I said, Gordon is TJC staff attorney and co-founder. He knows so much about the Medicaid program from his decades of experience, and he can really walk us through what we should be paying attention to and where to focus our attention. Gordon, take it away.
Thank you, Jane. Next slide, please. Excuse me. I want to return to the question of the marketplace coverage that Jane has already touched on, because that's really the time-sensitive issue. And just to provide a little bit of context, the Affordable Care Act, when it took effect in 2014, expanded coverage in two ways. It made insurance available on a commercial insurance on a so-called marketplace, electronic marketplace, where people could go on and buy different health plans through the ACA, through commercial insurers, and that coverage was heavily subsidized. The other way, of course, was through the expansion of Medicaid to fill gaps in the program. Sadly, we are one of 10 states that has refused to expand Medicaid. That has some other consequences, which I'll talk about in a moment, that distinguish us from the majority of states that have. But because we did not expand Medicaid, the coverage that's available through the marketplace is particularly important in our state and the other 9 states that refused Medicaid, because it's the only means by which low-wage workers with incomes just above poverty can afford to have health insurance. There are 628,000 Tennesseans who get their coverage through the marketplace, and the vast majority, something like 95% of ACA enrollees nationwide, receive a tax credit that lowers the enrollee's monthly payment for health insurance. And in addition to the standard premium tax credit, as Jane said, for the past 4 years, Congress has authorized so-called enhanced premium tax credits that were really established in recognition of the fact that the premium tax credits written into the original Affordable Care Act were insufficient to put in coverage within the financial reach of many, many families. So if you take away the enhanced premium tax credit, the coverage becomes unaffordable and people will have to drop their coverage. And next slide, please. Next slide, please. Just a word on what the mega bill does, the One Big Beautiful Bill Act does to the Affordable Care Act coverage. As we've mentioned in earlier briefings, the bill is designed to repeal the ACA, not with one single sweep, but through 1,000 cuts that combine to make it less valuable, more expensive, and more difficult to obtain and keep. Those changes are damaging enough in themselves, but the most immediate threat is the expiration of the enhanced premium tax credit. Ironically, as you all know, the big feature of the mega bill was to extend enormous tax cuts that were enacted in the first Trump administration that were due to expire, just like the enhanced premium tax credits were due to expire. But the mega bill extended the other tax credits, but did not extend the enhanced premium tax credit that are so critical to maintaining ACA coverage. And that disparity is really ironic in terms of who benefits from the big tax cuts and the ordinary people who stand to lose their coverage. So those are to expire December 31st. The mega bill didn't have anything to do with that. They were going to expire anyway, but the pressure was, of course, for them to extend those tax credit when they were extending the others, but Congress failed to do so. So, as Jane said, 197,000 Tennesseans will lose coverage soon after the expiration, simply because it becomes totally unaffordable without the enhanced premium tax credits. Another 46,000 will be paying higher premiums, and we could expect those premiums to go up by as much as 70%. Those who hang on at all costs to keep their coverage in spite of the increased cost due to the expiration of the tax credits, that will create what's called adverse selection, which is a technical term in insurance that says that if that's a situation where the only people buying the insurance are the people who are really sick because they're so desperate to have the coverage, and healthier people just determine that it's not worth the cost to them and they'll try to go bare. What that does is it destabilizes an insurance system because you have fewer and fewer people paying the premiums, and those people are sicker and sicker and have proportionately higher degree of losses, and it just becomes difficult to sustain the system. So this is quite serious for the whole Affordable Care Act marketplace system. It's estimated that if the enhanced premium tax credits are not extended, the number of uninsured Tennesseans will increase by 39%. And like I say, the destabilizing effects will have more serious consequences down the line. Next slide, please. This is a fight that we can win. As we've discussed in earlier conversations in these briefings, the Congress designed the Medicaid cuts primarily to take effect after the midterm congressional elections that will occur next year. They did that with the calculation of ensuring that people would experience the benefit of tax reductions, and those who are hostile to immigrants would see that the bill had increased immigration law enforcement, but they wouldn't, when they go to the polls, have experienced yet the loss of health coverage and the spiraling increase in healthcare costs. That was the way they designed Medicaid, but the fly in the ointment politically is that the expiration of the premium tax credits and the failure to extend those means that, as I've said, nearly 200,000 Tennesseans and many more than that nationwide are going to lose coverage at the end of this year. So that's a bad look going into the next congressional cycle. And there is some sensitivity on the part of the Republican majority to the risk that that poses to their ability to hang on to their narrow margin in the House of Representatives. And to go back to the context that Jane provided earlier, where she explained that the new budget year will start in October and that there will have to be a continuing resolution to fund the federal government operations past September 30th. What that means is that the Democrats have some leverage, and the Republicans who are concerned about maintaining the majority also will have some leverage because the vote will be tough to pass a continuing resolution, but one must be passed. So there typically at these points, a lot of legislation and a lot of members' wish list items get tacked on to the bill that they couldn't otherwise get through. So the need for the majority to address this political problem of a lot of people losing coverage, combined with the opportunity to get something through as part of the continuing resolution at the end of September. I hope that makes clear why we believe, A, this is a fight that we can win, and B, the next few weeks are really critical on this issue. The members are back in the district. They are touting the One Big Beautiful Bill Act, their talking points, as reflected in an op-ed piece that Senator Blackburn published in the Tennessean 10 days ago, talk about it's just a lie that anyone's going to lose coverage. Everything's going to be great. And she actually uses the language of the Democrats are lying. No one's losing their coverage. That's why we are asking that folks do two things during this break, during the next few weeks, that you communicate with your members that you're very concerned about the cuts that were in the One Big Beautiful Bill Act. They're listening, and their actions going forward will be shaped by the extent to which they think they are successful in selling the Big Beautiful Bill Act, or the extent to which it remains unpopular. And the polling, by the way, is that it is nationally generally unpopular. We need to help them understand that it's unpopular in Tennessee so that that tempers what they do going forward. And specifically, we need them to be sensitized to the need to continue the ACA premium tax credits. If you have ACA coverage yourself, or you know someone who does, please share your story or their story with us. Those stories are what will move this issue. And I'm going to talk about all the problems with the bill as it passed, but I want to just note here that the bill would have been much, much worse, but for the enormous outpouring of advocacy by you and our millions of other fellow citizens across the country. Many of the worst items were taken off the list. So anyway, we can win this one, and we just need to buckle down and make it happen. Next slide, please. So I want to clarify some things. I think we were not as clear as we wanted to be last week. And there's been so much written nationally about what was in the bill as it affected Medicaid that we want to take a moment to revisit. We're not going to go through the details, but during the course of the congressional debates, there were proposals that would have cost the Tennessee budget as much as $2 billion a year, which would have been catastrophic and would have had ripple effects across the budget, affecting even external to the Medicaid SNAP budgets, things like education. Those changes were made with respect to other states, but not Tennessee. And to back up just for a moment, the congressional Republican majority was very hostile to Medicaid, and particularly hostile to the Affordable Care Act, which they disparage as Obamacare, and to both the Affordable Care Act, but also to the Medicaid expansion. We didn't expand Medicaid. We're one of only 10 states that didn't. So a lot of the cuts in Medicaid were directed at the 40 states that did expand Medicaid, reflecting the animus towards the Affordable Care Act and the Medicaid expansion that was part of that. So as a result of our not being expansion state, a couple of major things in the bill that you will be reading about going forward, because they apply to most states, don't apply to Tennessee. Those include work requirements, which will not apply in Tennessee. As we mentioned, the state sought a waiver to implement work requirements. That's never been ruled on, but our reading of the new act is that ironically, although it mandates work requirements in other states, it will make it legally problematic for our state to go forward with that. The other thing is that there's drastic cuts in the ability of states to use provider taxes to fund their Medicaid programs. The effect of those changes is to shift Medicaid costs from the federal government to the states with potentially catastrophic consequences. Those tax changes do not apply or have no impact on Tennessee. So we dodged a bullet there as well. It will have tragic consequences throughout most of the country, but not in Tennessee. None of this is to minimize the damage that will be done in Tennessee, primarily by red tape, as we've explained before. But we want to clear up that the budget impacts that we talked about before are not, the Tennessee budget will not be affected. People will be, but not the budget. Next slide, please. People continue to have understandable questions about, will my category of coverage be affected? Will I lose benefits? And we just want to reiterate, in Tennessee, none of the categories of eligibility except those covering a relatively small number of qualified immigrants are affected. The way the savings will be achieved in Tennessee, and they will amount to some $70 million in reduced benefits each year in Tennessee. So this is quite significant. Those will be done through red tape by making it more difficult for people to enroll, and once enrolled, to keep their coverage. We've seen this happen over and over again. This law will perpetuate the red tape. It rolls back changes made in the Biden administration to streamline the process, make it easier for people to get and keep enrollment. Right off the top, it will create barriers to the Medicare savings programs that affect 280,000 people. It will make it more difficult for young children to get on and stay on. Having said all that, it doesn't make those programs or those categories goes away. It just means that to get into those categories, people are going to have to go through a lot of paperwork. Those will be rolled out over the next year, and people will not see an immediate change. Next slide, please. There are not a lot of affected people in Tennessee, but those who are, it is heartbreaking that we're going to see refugees, asylees, and trafficking victims lose coverages. We're going to see coverage being taken away from, for example, Afghan refugees, including families of Afghans who bravely worked with American forces in Afghanistan as translators. Same with Iraqi refugees, worked with Americans in that country as translators or otherwise helping American State Department officials and armed forces. And now we're taking away their coverage. So the only groups that are protected in that are Cuban and Haitian entrants whose eligibility is unaffected. Next slide, please. That I'm not going to go back through the other Medicaid changes, but I think the basic message we want to deliver is threefold as it reflects healthcare. One is the immediate issue of the enhanced premium tax credits under the ACA expiring and our need to act on that. The next thing is that some of the biggest changes in Medicaid that you'll be reading about will not affect Tennessee. And the third is there will be plenty that will affect Tennessee, but it will not be immediate, and it will not be in one clear-cut change in policy, but through, again, a grinding red tape obstacle course that people are going to be forced through, and we will be working to try to help people through that process and helping you all help the folks, your family or the folks that you work with, work through that process going forward. Jane, turning it back over to you. Thank you.
Thank you, Gordon. That was really helpful. And for folks who are typical with the format of this call, I'll take a minute at the end of both presentations to give you all a quick recap of what you need to know and what you'll be doing next. So thank you, Gordon, for that in-depth overview of Medicaid. I'll now turn it over to Signe to talk about what's going on the nutrition side.
Hi, everyone. Thanks, Jane. And thank you, Gordon. Again, thanks everybody for joining us to discuss the ongoing work on this bill. I wanted to dive a little bit deeper into SNAP. I'm going to keep it relatively brief this week, and we can go to the next slide. Jane had a really good overview in the beginning, just talking about the main areas that we've been lifting up throughout this whole process. We've talked a lot in the past about the state cost shift, which is going to be an incredible change to the program and a significant cost to the state. That's, again, not going to happen until after the midterm. So I'm not going to focus as much on that today. I'm really going to focus on the most immediate impacts that are coming out of the bill for the SNAP program. In those three areas, actually the two areas that I'm really going to focus on are work requirements, as well as the qualified immigrant piece. And the third one that I don't have listed here, but will happen before the end of this year, is the loss of the SNAP Ed funding. I think it's important, we've been really trying to advocate for these things not to move forward, but now that we're here, we'll be doing a lot of work to lift up the impact of this and really looking for ways to show how this was not the right move to help support the programs and the people that we serve who are struggling with food insecurity. I think it's important to let folks know right now. So for those on the line who work with clients and individuals who are trying to apply or keep SNAP, to let them know that SNAP continues to operate under current rules, but we are really trying to prepare right now for implementation. And we are waiting for USDA guidance to train DHS SNAP agency staff on how those rules are going to come into play. On the work requirement piece, I just want to reiterate the folks that will be most immediately impacted by the work requirement changes are seniors, particularly seniors between the ages of 54 up to 64. They are now added to having the expectation of meeting work requirements. In addition to seniors, families with children were never part of the work requirement requirement for SNAP, but now families who have children ages 14 and older will have to meet a work requirement. We are also looking at veterans, as well as houseless individuals and children aging out of foster care as well, who now must meet a work requirement. So we are concerned about this because it adds a lot more complications to the programs. Before the bill came about, we were really trying to move SNAP and USDA and our elected officials away from making work requirements a part of the SNAP program, because work requirements do not really work. They, in fact, make it much more difficult for people to find work, because if you're taking food assistance and basic needs away from people who are trying to find work, it makes it much more difficult to get work. And Tennesseans are working. We know that the majority of Tennesseans who can work do work. And so what this is going to do now is pull a lot of people who are faced with paperwork demands and burdens, who might be eligible for the SNAP program, and will place barriers in front of them and make it really hard to get through that process. And not only for the individual does this become complicated, it becomes really complicated for the state agency. This is a lot more unnecessary work for the state agency to get through in order to do all of this processing around the work requirement. So that's what we're kind of anticipating as we prepare for the implementation. Gordon talked a bit about the immigrant access on TennCare. Similar restrictions are coming into play as well for immigrants in SNAP. We've always protected immigrant refugees, asylees, people who are victims of trafficking, and have been able to connect them to the SNAP program when they've needed that support. That will be one of the most immediate impacts as well, along with the impact of the work requirement, that we will see people losing access and being cut from the SNAP program. We will continue to share updates on all of this as we get it. We're checking in with the state agency as well as USDA in hopes of getting a better sense of the timeline for when some of these immediate changes will come into play. And I also touched briefly on the SNAP Ed funding piece. States have always received SNAP Ed funding to help with education programs around healthy eating, addressing obesity, helping families stretch their SNAP dollar. Those programs and funding have been wiped as a result of this bill, and that funding stops in this next fiscal year. So that funding no longer comes through as of October 1st of 2025. So those are the most immediate impacts that I wanted to cover today. My next slide just kind of goes into the long game. Again, we've really appreciated everyone and all of your efforts to push back on the legislation that passed. We still have a lot to do as it has moved forward. It's going to be really important to educate decision makers, lawmakers, policymakers about the impact of this bill. How is it going to practically change access for the people that we work with, for Tennesseans? We want to lift that up in every way possible. So we will be working closely with people who are trying to apply, and for those of you who assist individuals in accessing SNAP and TennCare, and who are trying to work with individuals to keep those benefits. I think it's going to be really important for all of us to just be walking closely with those individuals during this period of time to figure out how they are navigating the process and lifting up any of the challenges that they're facing as we move forward in this new landscape. And we've talked a lot about the importance of individual stories. Just last week, we talked to a grandparent who cares for 5 grandchildren that they had not, that was not part of their plan, but they of course took in their 5 grandchildren, all who are over the age of 14, and these grandparents who are between the ages, are under the age of 65, right now they rely on SNAP to feed their family. So the grandparents caring for these 5 kids are supported by the SNAP program. They're able to put food on the table because they have the SNAP program. But once these work requirements go into effect, these grandparents who had retired and right now their job is taking care of those 5 children, they're now going to be expected to find work, so to return back to the workforce. And so we want to lift up stories like that and show how this really is a disadvantage for Tennesseans, for families who are struggling to make ends meet, and make sure that that's communicated to our lawmakers. The other piece that I wanted to talk about too is just the opportunities for change. We are going to look around every corner for opportunities to push back on the challenges that have been put in place because of this legislation. And one of the most the nearest opportunities may be the Farm Bill. So please stay tuned. We'll be talking more about that and other opportunities in the future. So with that, Jane, I'm going to turn it back to you.
Thank you, Signe, and thanks for that overview of the SNAP world. So like I said earlier, we've heard a lot of specifics from both Gordon and Signe about changes to Medicaid, the ACA, as well as SNAP. So I'm going to give a very quick recap of what you all should be paying attention to. Really, it's everything, but I think realistically want to let you know what the call to action is in the current moment, and then we'll turn to Q&A with Gordon and Signe. Next slide, please. So hopefully we've all gathered from the presentation today that we still have room to push our elected representatives. So first things first, we need to spread the word about the need to extend the enhanced premium tax credits. There are 197,000 Tennesseans who are at risk of losing their health coverage if that extension is not granted. So we have to use this opportunity while during recess and beyond to make sure that come January there is an extension of those tax credits, and that is for the ACA marketplace, and the risk is that almost 200,000 people will be uninsured. We also want to remind our senators Blackburn and Haggerty that we disapprove of the cuts that have been voted in. While there's still conversation around this being beneficial, we want to ensure that we are clear that at least for the health and nutrition programs, this was a disastrous decision at the federal level, and we want to ask them to reverse the cuts. So we are in a position to shape public opinion, as Gordon said earlier. The bill has been voted into law, but it's wildly unpopular, and we see quite a few elected congresspeople who are trying to sway public opinion, and our role is to make that a little bit more difficult because we know the truth, and that's that healthcare and nutrition is now in jeopardy. And on that note, you can also use your voice, use the information that you've gathered from these calls to you make social media, letters to the editors, op-eds, whatever forum you have available, making that a place to push back against any kind of claims that the bill won't hurt anyone. We are in a position to be clear that there is clear evidence that millions of people will lose their coverage, and it's our responsibility to make that clear and to ensure that that doesn't get obscured by whatever narratives might be floating around. We want to emphasize that on the Medicaid and the SNAP side, there is an impact on children who are the most reliant on Medicaid, at least in Tennessee, and the same is true for SNAP. Children really rely on these programs. So if we're making them harder to access, we're making them harder for children to benefit. And as always, share your story with us, please. Our comms team has put information in the chat. We will have another slide at the end with instructions, which you'll receive once you get the slides. Please follow our storytelling process. We've made it as easy as possible, and we would love to hear from you about how these cuts are likely to impact you. Switching to Q&A now, we have quite a few questions in our Q&A field. Gordon, Signe, can we have you both come on so we can run through some of these? All right. So let's start with, sorry, let me double check our Q&A field. Signe, we have some folks asking about SNAP. You went through the work requirements and we have some specifics. Folks are wondering, does the SNAP change apply to disability and those unable to work? And what are the exemptions available? How can folks be thinking about that?
Yeah, thank you. Thank you for that question. So yes, for individuals who have a disability, they are exempt from the work requirement. However, and that's currently the case, right? Work requirements already exist in the SNAP program, and that's oftentimes where we see lots of challenges for individuals trying to apply to SNAP. If they don't have a demonstrated receipt of a disability like SSI or SSDI, it can be challenging to prove that disability to DHS unless they're able to get some documentation from a medical professional. And even then, their chances to stay connected to SNAP are limited unless they have documentation like SSI, SSDI. There are other exemptions as well, exemptions for pregnant people, exemptions for people who are unfit for work. But again, in our casework, we often see people. It can be very subjective from caseworker to caseworker. So some individuals might be exempted depending on who the caseworker is that they get. And so with that, there's just so many challenges to making sure that people who are eligible for SNAP are able to access it. And so ideally the work requirement wouldn't exist. Work requirements just shouldn't be connected to the SNAP program, because even though there are exemptions, we see a lot of people fall through the cracks.
Can I just add a 2 cents worth to that, which is to talk about the interconnected relationships here. Sydney's talking about it's difficult to establish disability if you don't have SSI or SSDI. That requires Social Security to make a determination of your disability. That's a process that takes 2 to 3 years already, and we've seen the budgets cut for the Social Security Administration, which means that's going to be more difficult. That's connected to advocacy with the Department of Human Services because they have some flexibility in how tight or loose they make the requirements for proof. And it goes to our larger point about the role of red tape in determining this. So you may have proof of disability, but if DHS is not processing that correctly, or if you don't have access to a computer, if you don't have the wherewithal to run that sort of gauntlet, it doesn't make any difference. So there's lots of opportunities and need for advocacy going forward. We appreciate everyone staying involved in these conversations because when we find out more about the USDA guidance, the CMS guidance in the case of Medicaid, we will be looking there for opportunities to try to influence the way the state implements these policies. The state will have important decisions to make. Not the least of those, our legislature will have to decide whether it's willing to put up the additional funding that's now required to administer the SNAP program, and if we don't get our error rate down, the substantial amount of additional funding that has not been required before, but that will be now required of the state just to fund SNAP benefits. So I think we probably all wanted to just let out a sigh and catch a breath after this law was signed into effect. But we now move on to the next phase, and our families, our neighbors, our communities are more reliant than ever on as many people as possible trying to mitigate the harms, influence the state, and push back on the narrative about what this bill does. I'll get off my soapbox, but I wanted to just make the point about how all of these different pieces tie together.
Thank you, Gordon. And just because we've gotten a couple of questions about work requirements on the SNAP side, I just want to reiterate some of what Signe shared. So SSI and SSDI documentation will help you get an exemption for disability that prevents you from working under SNAP. But if you have a letter from a medical professional, that can also be helpful for your caseworker to evaluate whether you can be exempted from the work requirements. So we talked a lot about Social Security, but don't want it to get lost that documentation from a physician is really helpful. Gordon, turning it over to you. We have folks asking about the Medicare savings program. So if someone asks if we have patients needing to connect to the Medicare savings program, they've been directed to AAAD, the SHIP program, and Tennessee Justice Center to help with applications. Is that still the best approach at this point?
Yes. The SHIP program, for those who don't know, is a program of longstanding that provides funding to the state to hire counselors to help Medicare beneficiaries navigate the complexities of the program. It's been a low budget, high impact, really a cost-effective program. The last I saw, the budget bill, either the budget bill or DOGE took away funding for that. I'm not sure where that stands right now, but we'll find out and follow up next time or in the email that we send after this. So I'm just not sure about the SHIP program as a resource, but certainly TJC, to the extent that we have the staff to do it, we'll try to help people with with any difficulties they have with the Medicare savings program.
Thank you. Back to you, Signe. We have some questions on SNAP. Can you just quickly recap how much Tennessee paid and state admin costs last year for SNAP, and how much the state budget will be impacted by the cost shifting?
Yeah, so the previous year, turning to my notes, in the so previous years, and currently, the state pays 50% of administrative costs, and now that's going to shift to the state paying 75%. That is going to be it's going to be a significant change for DHS. Just to give you a sense of what our administrative costs were in 2023, it was over $256 million, and that was Tennessee paying for 50% of the cost. So that's going to be bumped up in future years. So we will be paying 75% of the administrative costs. And then on the benefit piece, that all depends on the state error rate. So if our error rate is high, we will have to pay up to 15% of the cost of the benefit. And in 2024, we had $1.62 billion in benefits that came to families. So we could potentially be responsible for 15% of that, which is a really, really big expense. When the state has paid $0 for benefits in the past, it's always been the federal government. So we will have to come up with millions of dollars in costs if the error rate does not remain low. And then the other thing that just to the error rate piece, that just the way that this bill rolled out does not make a lot of sense. First of all, SNAP error rates do not measure fraud. It's really a matter of whether or not the state is processing applications in the correct way. And states get dinged with error rates if they're paying individuals too much SNAP benefits. If they've determined the SNAP benefit is at a certain level and it's too high, the state gets penalized for that. The state also gets penalized if they've calculated the SNAP benefit for an individual and it's too low. So this is really state errors coming into play. Sometimes it's based on individuals providing wrong paperwork, and in very rare cases, fraud, but it is mostly state clerical errors that is now going to be penalized because of the bill. And the other thing that I would add to that too is there are already penalties that exist for states who have high error rates. So all of this is happening to the state, and is going to cause a lot of complications, and also a lot of uncertainty about how the state's going to afford this, and we're even concerned about states backing out of the program entirely. And we will definitely be talking about this more in future calls.
If I may, I did some calculations during the pendency of the debate in Congress to share with state officials about the implications of this. That we're looking now at an increase in administrative costs of $77 million to the state. That's an increase. If our error rate doesn't come down at our historic rate, we would be liable for $321 million in paying for the benefits. That, again, a cost that the state has never had to bear before. Those of you who deal with the state budget or seek payment for programs for the state budget will know these numbers are very serious. Very, very serious, particularly the $321 million figure. That we have a fight on our hands to persuade our state to pick up those costs. Now, as Sydney was saying, they don't immediately take effect. So there's some opportunity to bring the overpayment error rate down. But we need to be educating our state legislators about the importance of this program and that it's worth the investment. And also, just to make an additional comment, it brings us back to the summer EBT program and the state's unwillingness to leverage a few, $3 million to leverage over $70 million in summer EBT. With the budget now under these pressures, we will need to continue our advocacy and pick up every available federal dollar available for nutrition. So again, this stuff all connects to each other. It's not a single issue that confronts us. And we need to hang together because we're more effective as advocates if we're working together.
Yes, thank you, Gordon. We are just at time, so we're going to run through the very last few slides here. Next slide, please. So just a reminder, we do have a fact sheet that lists out the provisions of the bill and their effective dates, just to get a sense of what is coming down. So we'll send out a link to that, and it lives on our website. Next slide, please. We also have our standard call to action, which is for you all to register to vote, to follow TJC, because we share so much information on our social media, and stay informed through some of the hubs we have on our website, where we keep you all posted on everything we share here. Next slide, please. Some instructions on contacting members of Congress during recess. There will be town halls and state fairs and other gatherings where they will be present. So please join and get your community members to join as well. And we can just move on to the last slide. But with that, I just want to thank you all for coming. We have quite a few questions in the Q&A that we didn't get to, and we'll, you can move past this one. We have quite a few slides that we did not get to, but we will be sharing all this information with you all over email, and be prepared to convene at the end of August, or August 20th, on our next call. So thank you all for joining us today, and we appreciate your time as usual.